Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
I'm WVUA 23's Ashley Berry, and this is Health Matters. Today, I'm sitting down with Dr. Jamie Reeves. He is an associate professor of psychiatry and behavioral medicine with the College of Community Health Sciences and a practicing psychiatrist at the University Medical Center. He is also director of the college's new psychiatry residency, which was created to help address a shortage of access to mental health care in Alabama, particularly in West Alabama. And the first class of residents actually begins training in July. Well, May is Mental Health Awareness Month, so thank you so much for being here, Dr. Reeves. Today we're going to talk about how mental health looks physically in our body, how it manifests physically. Can you talk about that? What are we seeing? How is it looking when we're going through these chronic stress symptoms?
Well, first of all, Ashley, thank you for having me. It's great to be here again with you. Physical health is mental health, and mental health is physical health. So many times people, I think, separate the two, but they're closely intertwined. I'll just give you an example. I had the flu a number of years ago, and I was sick in bed, and I was so tired I couldn't get up. It was very difficult, and I did not want to do anything. I was just wanting to sit in bed and look at the ceiling, all just miserable. So although it was flu mentally, it took a toll on me. And the same thing for people who experience depression or anxiety. Those symptoms can manifest as physical symptoms. And so the two are intertwined very closely. And so it's something that you have to realize is that although you may be having physical symptoms, could there be something mentally that could be creating that? And that comes in different shapes and sizes. So for example, depression is very common. About 1 in every 5 people experience a bout of depression. Some symptoms of depression is not just necessarily that you're sad and you're tearful, but you may, again, just like the flu, lose that interest. You just want to sit in bed all day. You have no energy. You just can't focus on anything. It's just hard to keep track of things. Not only is that fatigue, but you're really less active. And you may think, oh, maybe it's my thyroid. Maybe it's something else going on. But maybe it's depression. Maybe it's that lack of enjoyment that's at the root of all of this. And so anxiety is another great example. People have anxiety. It's not just you're worried all the time, but that worry can cause you to be tense. It can cause you, again, to lose focus, to lose sleep, to be on edge, to have muscle tension, to have headaches. So it may be a physical symptom, but underneath it all, it certainly could be anxiety or depression. It could be at the root of a lot of these problems.
Yeah, you spoke specifically about depression, and from some of the research I did, I kind of saw that with depression, a lot of times physical symptoms come before these emotional feelings that we feel. Is that something that you've seen as well?
Absolutely. Some people may not notice emotionally because they're not really paying attention. Maybe their family notices it or something like that, but how they notice it is that they don't show up to work and they call into work sick, or they're not getting the things done that they need to get done. And those things then start to become noticeable to a person before they even realize that there's something emotionally different about them. A lot of people may not have insight into how they're feeling. They may not be thinking about how they feel, but it's the physical symptoms that start to come out first. So it's that fact that, hey, I'm only getting 2 hours of sleep a night. What's wrong with me? There's something got to be wrong with me. Maybe it's something that you're not noticing in terms of your underlying mood and depression that could be cause of that.
And those physical symptoms, we see things like headaches, GI issues, even chest pain. Those are some pretty severe symptoms. And how does the way we feel emotionally and mentally, how is that link happening so severely?
Yeah, there's so many things that are tied to the brain. The brain is tied to every part of our body, especially our gut. You mentioned about sometimes people have upset stomach or they lose their appetite, they're nauseous. That's because there's a vagus nerve that ties the brain to the gut, and that becomes very much a part of those symptoms. But every part of your body physically, every organ is attached to the brain in some respects. So when you go through a mental health issue, depression, anxiety, whatever, it manifests itself in some kind of physical symptom in some way because of that close connection. So people, you mentioned about panic attacks. It's a type of anxiety. And people who have a panic attack could swear that they're dying of a heart attack. Many people who show up in the emergency room with thinking that they're dying because they can't breathe, their heart is beating out of their chest, they have chest pain, and they look at this, their heart's fine. What's going on? Is this is a panic attack? And panic attacks, again, very common in the population to experience a panic attack. So it's important to think about getting your chest, getting yourself checked out by your primary care doctor physically and your thyroid and those things like that. But also mentally, could there be something that you may need to think about too that you could address?
Have you found in your practice that you can identify that this is a mental health issue right away, or do you go through all of these tests and people come in with these unexplained illnesses? Like, at what point are you like, this is a mental health problem and this person deserves to get some help with that?
That's a great question. And many times that can be very difficult to tell. A lot of times we do all the initial tests. We check your thyroid and check your blood counts and check the thing, maybe check your heart. Could this be something that we're missing medically? Once you've kind of ruled out all of those things to make sure there's nothing medically that you're missing, that's when we start to think, could it be psychiatric in nature? And there's some things that are obviously more psychiatric. So if someone's very tearful, let's say they lost a loved one in the past month or two, it's been very difficult for them. That certainly sounds more psychiatric than the given the loss that they experienced. So some things may point towards a more mental than a physical reason from the very beginning, but we always want to be sure as doctors that we're making sure there's nothing medically going on first before we immediately jump to a mental health reason.
And you're clearly someone who is great to work with when it comes to these issues. You know, some people might not be as lucky. What does it do to someone, like psychologically, when they go into multiple doctor's appointments and are told that nothing is wrong? Like, should they advocate for themselves and think maybe this is a mental health issue? How can they identify that in themselves?
Yeah, that's a great question. It is can be frustrating. I think doctors are going to see, going to different clinics and not being told that there's anything wrong with you could be certain very frustrating and very demoralizing. And what's wrong with me and what's wrong with the healthcare system that they can't find out what's going on. And so I just, continue to encourage people to talk to someone about that. Maybe that they have a loved one that they can talk to. How are things going? Is there anything that you're concerned about or different about me? So if it's not a healthcare that's looking to that, then they may want to think about a counselor, is turning to someone within the realm. There are lots of very good therapists out there. You can find people online very easily to talk to and say, I've been going to see doctors and they're telling me that there's nothing wrong with me. Can you talk to me? Could this be something mental? So whether that's a friend or family member, whether that's an online counselor or someone you can find locally in-person appointments. There are plenty of therapy clinics here in town. Certainly, I'd encourage people to think about that if it looks like they're not getting anywhere with the regular medical establishment.
Yeah, and it sounds to me like you're really emphasizing that mental health is healthcare today. There are a lot of stigmas surrounding speaking up for yourself when you're going through a mental health issue. Is that something that you've seen and experienced, or what's your advice for people who are afraid to get help?
Yeah, that's a great point. I certainly in certain populations it's higher. I think men especially. There's nothing wrong with me. I'm not depressed. That's only for weaklings. I'm a man. We don't get depressed. So certainly it could be difficult, or for certain people that are afraid to get help for however it's going to be perceived within their community that they're in, their neighbors or others along those lines. But it takes courage. It takes courage to ask for help, especially if some of these like men or something like that to say. But it's by asking for help, you're not only helping yourself, you're helping others out there too. So it may be hard to be a good father if you don't want to go to your kids' games because you're so depressed and tired. It may be hard to be a good husband, or it may be hard to be a good wife or a teacher or an employee, whatever that may be. So by addressing those underlying issues, by having the courage to stand up, ask for help to get better, you can be a better father, a better employee, a better coach, or whatever occupation or thing that you're involved in life. So really, I encourage people to do that and to think about not only helping themselves, but helping others because of the different ways that you may not be functioning as fully as you'd like to in life.
And you've spoken a lot about, detection, these tests that are ran. What does the treatment process look like as far as like medication, if someone needs something like that? Just talk a little bit about that.
Yeah, that's a great question because what I tell people is people think, oh, you have to see a therapist or you have to take medication. That's actually not actually the case, to be honest. There are a lot of things that you can do to feel better that work quite well that aren't medication or therapy. For instance, go outside and go for a walk. People don't think about how healing a good walk could be. The studies show that going out for 15 to 30 minutes, especially in nature, clears your head. I was a cross-country runner for many years, and we would always talk about a runner's high. After you finish going for a run, you feel really good. Exercise releases these endorphins inside your brain. Those endorphins help to relieve stress. They relieve anxiety, relieve depression. So regular exercise is a great antidepressant, a great way to treat anxiety. Eating properly is another important thing. People oftentimes lead to fast food or processed food, fried food, which really can damage the gut, which can turn damage the brain, and people get depressed and anxious from a bad diet. So eating healthy food, fruits, vegetables, and nuts, olive oil, nut, fish, really good for the brain, really good for your mood and for your overall well-being. Talking to someone, being with a friend group, going to church, whatever that may be that you're interacting can help people emotionally quite a lot as well. So there's a lot of simple things you could do. Does not have to be therapy or medication that can get you feeling better quickly. If you try those things and you're still not feeling as well as you'd like to, then I say it's time to maybe look into an appointment.
Yeah, so people can really start now to try and turn their lives around when it comes to mental health. Do you wish that this was more a part of maybe school programs, that they were taught this from a young age? I don't know if you've seen a rise in mental health issues because of maybe technology or social media. Do you know how these things are kind of progressing with time?
Well, I'll say, first of all, I'm not a child psychiatrist, so I'm not as up to speed on some of these things some of my colleagues are, but I will say there has been a rise in adolescent ER visits, especially for young women, not so much for young men, but for adolescent girls. There's been a big rise. There's been a question as to why is that there's been such a rise in the last 5 years or so about young kids, young women, especially young girls going in. And there's a thought that maybe social media could be at the root of a lot of this. Feeling imperfect, feeling bullied. Bullying was something you did in the schoolyard. Now you can do it 24/7 through an online social media platform. So it's much more prevalent than it was before. And every kid has a phone, and it's easy to kind of judge yourself amongst other people on certain social media platforms. So that's become a big issue within the psychiatric community, but I think within the tech industry as well. It's trying to make this a better hospitable place for young people, especially young girls.
And I know a lot of university medical centers about expanding resources, especially in rural communities. Do you see these issues pop up in rural communities more than in regular communities, or is there kind of a difference there?
I think rural communities are difficult because there may not be as many resources in rural communities, and so people may have a difficult time getting help, and that can be hard. As you recognize it, but how can I get help? What are some options? I go back to online resources and things like that are out there. So yeah, even though you may living in a rural community and you feel that you need some assistance, is look at various ways that you can do that. Certainly at University Medical Center, we try to have as many rural clinics as possible. And as the new psychiatry residency program, we're certainly going to be emphasizing working in rural communities to help meet those needs that are out there. And in rural communities also, I think, again, people that are more working at farms or ranches or working manual labor type things, again, I don't need help. I don't, that's not part of our existence in our community out here in a rural area. We don't get depressed. And so it's important to kind of go behind that stigma and go behind some of worrying about being in a small community, how that's going to be perceived, and overcoming that thing and asking for help if it's something that's really impacting you or your family.
Yeah, and lastly, why are months dedicated to mental health awareness important?
I think it's important for us to take a step back and realize that, oftentimes we forget about our mental health. We're so consumed with our work, with our family, with our other responsibilities, and we don't realize that sometimes these things have a way of creeping up on you without even realizing it, that all of a sudden that things are different in your life and you're not really quite sure why. So mental health awareness gives you some idea to take a step back and be able to realize, how am I doing? How am I feeling? Or in a loved one, how is my children, how are they acting? How are they different? How to make sure they're getting the help that they need. Talk to them about any changes or your spouse or friends or something like that. So if we should all be aware, not only for ourselves, but for our friends and family as well.
Well, thank you so much for being here, Dr. Reeves. We appreciate it.
Thank you for having me.